Welcome to our Enhanced Recovery presentation. If you have been asked to watch this YouTube clip, then you will be planning on having a total knee replacement. My name is Sarah and I'm an occupational therapist. I have my colleague Karen with me, who is a therapy technician. Together, we are going to take you through some of the things that you need to know prior to having your knee replaced, especially regarding the therapy treatment that you will receive. Besides watching this presentation, you will get to speak to one of the therapists prior to your surgery. This is to go through details specific to you and your home, and it will be an opportunity for you to ask questions. During this contact with you, we will identify if you need any equipment at home, such as toilet frames. Any equipment identified will be ordered for you and is on free loan from the local equipment provider. During this short video, we are going to talk about the things you can do at home to reduce risks, the Enhanced Recovery Programme, and a little about your operation. We will demonstrate the exercises you need to do, talk about your progress after surgery, and give you advice on follow-up treatment. When preparing your home prior to surgery, we would advise you to remove any rugs and mats and move any trailing wires to ensure that you have clear pathways around your home. If you have items on low shelves that you regularly use, then we would advise you to move them to a higher position. If you tend to get up during the night, then make sure you have a lamp by your bed within reach. Think about how you will manage your meals at home, especially if you live alone. Now is the time to be stocking up on food or cooking extra and freezing meals in preparation for your discharge. We advise you to avoid carrying heavy shopping or using a heavy vacuum cleaner. If you think you will need help on discharge, then you will need to organise this. Our expectation is that you will be able to move around and look after yourself on discharge, and so we won't be arranging care for you. Please also plan for a friend or relative to accompany you home from hospital when it is time for you to be discharged.
When you have a date for surgery, you will need to pack for coming into hospital. It will be very important that you get yourself dressed, as you are not ill, but recovering from an operation. We advise you to bring in loose, comfortable clothes, as you will be sore and likely to have some swelling around your knee. Please bring enough night and day clothes for your stay, which will be approximately 2 to 3 days. Please also bring in a pair of supportive shoes or slippers, ideally slip-on or Velcro fastening, that have a supportive back to them. We would advise you not to bring in new footwear for coming into hospital, but bring in footwear that you have worn at home and that isn't too tight on your foot. If you are currently walking with a stick or a frame, then please put your name on that walking aid and bring that with you, along with your information booklet. Enhanced recovery is an evidence-based approach that we follow, which helps speed up recovery after surgery. The team will be making sure you are as healthy as possible prior, during, and after your operation. The earlier you get out of bed and start walking after an operation, the shorter the recovery time is likely to be. Enhanced recovery is about making sure you are more active in your recovery and ensuring that you are better prepared to manage once you are back at home.
You will have received a letter telling you where and at what time you need to come into the hospital for your surgery. You will be seen by your surgeon and the anaesthetist, and when it is time for your operation, you will be taken to the anaesthetic room and then into theatre. After your operation, you will be taken to the recovery room, where you will be monitored until you are taken to the ward. You will be up and sitting out of bed on the same day, aiming for this to be in time for your next meal. The nursing staff have been trained to assist you with this. Your aim is to start walking with the frame to the end of the bed or to the bathroom. While you are in theatre, your surgeon will inject pain relief to target the area around your knee. So when you come back from theatre, you should have good pain control. You will be given routine pain medication during the day. Extra pain medication is also available, but you will need to ask for this. Initially after surgery, you'll have a tight bandage around your knee, and removal of this on the day after surgery helps to ease discomfort. We use ice therapy to help reduce swelling and pain. You will use an ice pack for 15 minutes in every hour. Once you return home, you will need to use something like a bag of frozen peas as an ice pack that you can keep putting in and out of the freezer. Don't apply this directly to your knee without wrapping it in a pillowcase or towel. Early movement and a regular change of position will help to alleviate the pain. Elevation of the leg and ice therapy will help to reduce the swelling.
It's a really good idea for you to start to learn the exercises in your booklet now so that you and your knee will get used to what it needs to do. And you'll also help strengthen up the muscles in preparation for your surgery. I will now do a short demonstration of the exercises that you will be asked to do. Your exercises will begin when you are in recovery, as soon as you feel able to start doing them. This will begin with just some gentle exercises. So deep breathing. Get those lungs filled up with air. And then we're going to focus on circulation. So pointing your toes away, pulling them up towards you. Pointy toes, pull up toes. The next exercise, we're going to focus on the knee. I'm going to pretend I've had this knee replaced. I'm going to tighten my thigh muscle and I'm going to squash down my knee, pulling my toes back up at the same time. Hold for 1, 2, 3, 4, 5. Relax it. Completely relax before you carry out that exercise again. Squash your knee tight, tighten this muscle, pull your toes up towards you. You're going to need to get that knee moving, so you're going to need to try and bend it. Try and gently pull your foot back towards you. Remember, you're going to have quite a heavy bandage from about here to here on this knee. So you're probably going to find that quite restricting. But it's still important to get that knee bending. So whatever movement you can achieve. Gently back down. Bend up and gently back down. On day 1, after your operation, you will be seen by a therapist on the ward and we will take you through some more vigorous exercises. These are all in your booklet. If you practice them at home, you will be used to doing these exercises and your knee will know what it needs to do. You will need a rolled up towel or blanket, anything like this. You only use this when you're doing this exercise. It's important not to have anything under your knee any other time. Pop it under your knee, move it around, get it comfortable. You're now going to need to squeeze your thigh muscle, pull your toes back towards you, and try and lift up your foot. Squeezing those muscles all the time. Hold again for 1, 2, 3, 4, 5. Slowly back down. And relax. Again, squeeze this muscle, pull your toes back towards you, and lift that foot. And slowly back down. The next exercise we call a straight leg raise. The clue is in the title. You need a nice straight leg. Squashing those muscles again, bringing your toes back towards you, you'll feel everything tighten up and become stronger. Now you're going to aim to lift your leg. Focus is on keeping your knee straight. Hold again for 1, 2, 3, 4, 5, and then control back down to the bed. I'll do that one more time. Squash your muscle down on your thigh, bring your toes back towards you. Nice straight leg. You don't have to lift it very far. Those muscles will work really hard, just trying to lift that foot off the bed, holding for 5, and slowly back down. You need to bend your knee. Try and get your foot flat on the bed and bring that foot back up towards you. Hold it for a few seconds if you can, and then back down. Back up, and back down. We aim for you to carry out your exercises 4 times a day, 10 of each exercise. You will be shown these exercises by the therapist, but it will be down to you to carry them out. You will be seen by one of the therapists on the day after surgery, which is what we call day 1. Initially, we will get you to walk with a Zimmer frame, and we will be looking at the way you walk. You will need to take regular walks on the ward by yourself, if you are safe to do so, or with a member of staff. I'm going to demonstrate the exercises that you will need to do 4 times a day. In addition to the bed exercises that we have demonstrated for you, you will need to do some exercises in the chair. Again, concentrate on your deep breathing. Get those lungs filled up with air. Circulation, up onto your toes, up onto your heels, up onto your toes, up onto your heels, nice and gentle. Now we want to get that knee joint moving. It'll stiffen up if you don't move it, and we want to avoid that at all costs. Try and straighten out your knee. I'm going to pretend I've had my right knee operated on. And you're going to squeeze that thigh muscle and concentrate on getting that knee as straight as you can get it. Hold for 5 seconds. 1, 2, 3, 4, 5, and bring it slowly down and completely relax. You might hold your knee in a slightly straightened out position because of swelling and pain. It'll only do what you make it do, so you need to get it to bend more. So to get your knee bending, slide forwards and back, just nice and gently. You can use something under the foot, like you carry a bag, or one of the nurse's plastic aprons, just to help it slide on the surface of the floor. Try and carry out a few of these exercises every hour. We would aim to progress your walking from a frame to sticks. If you have your own stick, we will check that it is the correct height for you. If you require one stick, we would aim for you to hold the stick in the opposite hand to your operated knee. We will issue you, from the local equipment provider, the appropriate walking aid that you need to take home. This will be on free loan to you. You will need to take your painkillers, use ice therapy for 15 minutes per hour, and continue doing your knee exercises 4 times a day. The therapists will practice steps or stairs with you if you are ready for discharge home.
As previously said, we don't consider you to be ill following surgery, but recovering from an operation. These are things that you should expect to do on the ward. We want you to get dressed in your own clothes every day and to sit out of bed for all your meals. Ask for ice, and if you need it, remember you can ask for extra pain medication. But you do need to expect your knee to be swollen, hot, numb, and painful. Carry out your exercises 4 times a day. Don't sit or lie or stand for long periods of time. Take regular short walks independently if you are safe to do so. These are the things we expect to happen for discharge. The doctors to be happy with you. We call this being medically fit for discharge. Your wound will be redressed if required. We expect you to be independent walking with an aid, and independent with things like getting yourself in and out of bed, getting yourself washed and dressed. We aim for your knee to have a 90-degree bend, for you to be able to do a straight leg raise with no bend, and safe doing a step to get into your home or the stairs if required. You will be referred to your local physiotherapy department for follow-up assessment and advice to progress your strength, range of movement and walking. You will need to arrange your own transport to these appointments. Once you are home, if you have any concerns about anything you think might be related to your knee surgery, then we ask you to contact the orthopaedic specialist nurse as soon as possible. If you are phoning at the weekend or during the evening, then you will need to contact the on-call orthopaedic registrar. Both numbers can be found in the back of your total knee replacement book.
Here are some things for you to consider once you are back at home. Driving. If you are a driver, you will be unable to drive for 6 weeks after your surgery, but you can still travel as a passenger. Before you resume driving, you will need to make sure you can perform an emergency stop without discomfort or hesitation. Equipment. We encourage you to use any equipment we have provided you with until you can manage safely without it, and to return it to the local provider when you have finished using it. If you look at the equipment, you should find a sticker with the contact details. Work. You will need to be off work for about 6 to 8 weeks. This will depend on the type of work you do. You will not want to be in one position for a long time. Your exercises need to be continued at home, gradually increasing your walking distance, and you will need to continue to take painkillers and using ice as required. Please expect your knee to take 6 months to 1 year to regain full function. You can expect to experience pain during this time. A knee replacement needs a steady, persistent approach to exercise, day after day, to reduce pain, improve stiffness, and return to full function. Thank you for watching.